peripheral arterial disease is caused by the buildup of fatty acid and calcium in the arteries of the lower extremities, as you see there. And so patients will undergo a peripheral catheterization in order to open up and restore blood flow in these arteries. As you see here, a needle is inserted into the artery, and then the guide wire can be navigated through the lumen of the artery. The femoral artery is the most common access site for catheterization, but when treating peripheral arterial disease, alternate access sites lower in the extremity are often required. The problem is that these vessels are much smaller in diameter, and they're heavily diseased and calcified, which makes accessing them very challenging for the physician. They often require multiple attempts to create access, causing unnecessary damage to the artery and increasing the time of the procedure. So our goal is to create a device that decreases the force required to access these calcified arteries, which reduces the chances of puncturing through the back wall of the artery and causing unnecessary damage to the arterial wall. And this also helps reduce the time and number of attempts required to create access.
Part of the problem with accessing calcified arteries is that the calcium inside the vessel causes the needle to either deflect or the artery to push away. To solve this problem, we've constructed a device that works in conjunction with current access needles. So our device is the one at the top right, and the green device here is the current access needles used in conjunction with our new device. The important part of our device is the trocar tip and the threads at the end of it. The trocar tip allows our device to gain initial access into the artery, and with a rotating motion, the threads further advance our device into the artery before then sliding the current access needle over top of our device and pulling our device out and continuing with the catheterization procedure.
This is a standard micropuncture introducer set that's available from Cook Medical. It includes a 21 gauge access needle, a 0.018 inch guide wire, and a 4 French sheath. So we envisioned that our device would be included in a standard introducer set like this. That way the physician has the option to use this device on any procedure if they were having difficulty obtaining access. So the way an access procedure would work with our device is that the physician would have the current access needle. They approach the artery at a 30-degree insertion angle. They have difficulty penetrating the calcified wall of the artery, so at this point they would elect to pick up our device, and it's inserted through the hollow access needle. And when they get to the wall of the artery, they can use a twisting motion so that the threads can anchor into the calcified wall of the artery. And then once the driver obtains access in the artery, the access needle can then just slide over the driver. The driver pulls out from the access needle and the procedure continues normally.